Welcome to today's webinar, the Public Health Nurse and Health Equity. We apologize for being a few minutes late. We did experience a minor technical difficulty. Our webinar today features Zenobia Harris and Jennifer Cooper, both members of our Association of Public Health Nurses, and we'll tell you a little bit more about them in a minute. And it's brought to you through a partnership really between the APHN Public Health Nursing Section, the Association of Public Health Nurses Education and Training Committee, and the North Carolina Department of Public Health Nursing and Professional Development Unit. Next slide. So we just want to remind you about the way we've set up our webinar today for phone and webinar etiquette. All the attendees' telephones will be muted. If you have a question for the presenters, type it into the question window on the right side of your screen and click on Send Privately, please. Questions will be answered at the end of the session in the order of which they were received, and we would like you to please refrain from sending messages to the entire audience during the presentation. Now, in terms of disclosures, our required disclosures, the presenters and planners of this educational activity have no conflict of interest and have not received any financial support for any part of the planned program for this presentation. So let's also go over how you get your nursing credits. In order to successfully complete the education activity and receive one nursing contact hour for this webinar, Association of Public Health Nursing members and North Carolina PHNs must attend the entire live presentation today and complete the online course evaluation, which will be emailed to registered participants, APHN members, and North Carolina PHNs who were on the live webinar. Continuing education credit will only be provided to those APHN members and North Carolina PHNs who attend the entire educational activity today and complete the evaluation form within 30 days following this live presentation. The webinar will be archived and slides will be posted on the members section of the APHN website, which is phnurse.org. And for our accreditation statement, continuing education credit will be provided through the Public Health Nursing and Professional Development Unit. The Public Health Nursing and Professional Development Unit at the North Carolina Division of Public Health is an approved provider of continuing nursing education by the North Carolina Nurses Association, an accredited approver of the American Nurses Credentialing Center's Commission on Accreditation. Next slide, please. Our presenters today, Dr. Jen Cooper. Jen is on the APHN Policy Work Group. She is chairperson, and she is a Million Hearts and Nursing Community Liaison. And Zenobia Harris, Dr. Zenobia Harris is the APHN Region 6 Director and also the chairperson of our Diversity and Social Equity Committee. Next slide. And we'd like to give special thanks to Dr. Lisa Weiss from the APHN and APHN Public Health Nursing Section, and also to our APHN Education and Training Committee. Next slide. Our objectives for the webinar are to highlight how the experience, knowledge, and skills of public health nurses are promoting health equity and a culture of health in the U.S. We will illustrate the significant role of public health nurses in identifying and improving social, economic, and environmental conditions that shape health and promote healthy behaviors, and determine how to engage other public health nurses in health equity promotion movement. The learner outcome is, as a result of attending this webinar, participants will increase their knowledge of work being done by public health nurses in U.S. communities to promote health equity and create a culture of health. And I will now turn it over to our speakers.
Thanks, Michelle. Hi, everyone. This is Jen Cooper, And I'm going to just kick us off here by talking about APHN's commitment to public health nursing. And first of all, let's talk about what is public health nursing. And I think that the organization's commitment to that role is described in our mission statement, which is to shape the role of public health nursing within the specialty of population health, and to educate and advocate for policies and practices that advance the practice of public health nursing to promote the public's health. So public health nursing is the practice of promoting and protecting the health of populations. And we do that using knowledge from nursing, social, and public health sciences. While we're familiar with that most nurses care for one patient at a time, public health nurses care for entire populations. And by working with whole communities, public health nurses are able to educate people about health issues, improve community health and safety, and increase access to care. Some of the things that public health nurses do are monitor health trends and identify health risk factors unique to specific communities. They'll set local priorities for health-related interventions to provide the greatest benefit to the most people. They advocate with local, state, and federal authorities to improve access to health services for underserved communities. They design and implement health education campaigns and disease prevention activities, such as immunizations and screenings. And they tell people about locally available healthcare programs and services to improve access to care. And also they educate and provide direct healthcare services to vulnerable and at-risk populations. Public health nurses believe that a person's health is affected by many factors, including genetic makeup, but also lifestyle and environment. Instead of waiting for patients to come to us or come to the hospital with an illness, public health nurses go into communities to try to help people improve their health and prevent disease. For people who don't have access to care, public health nurses may also provide direct care, including preventive care, screening services, and health education. Health education really is the primary focus of public health nursing. Drawing on their training as registered nurses, public health nurses give people reliable and useful information about how to protect their health. They'll offer presentations at schools, community groups, senior centers, and other local groups. And public health nurses explain things such as proper nutrition, effective safety practices, promoting early detection of common diseases, and they tell people how to care for a disabled or ill family member, and they'll inform people about what are some of the other important health issues. Their goal is to make health information easy to understand so people can take greater control over their well-being. In low-income and rural communities, public health nurses can provide critical health care services. They'll immunize school children, provide prenatal and well baby care, and teach the elderly how to stay safe and healthy in their homes. They also must be able to recognize and respond to potential health crises. Public health nurses often work for government agencies, but also nonprofit groups, community health centers, and other organizations that aim to improve health at that community level. They may work alone or on a multidisciplinary team, and they often supervise other healthcare and lay personnel. In addition to working with communities, they work behind the scenes to plan activities, manage budgets, and evaluate the effectiveness of public health programs. They may travel locally or across significant distances to meet with community groups and bring healthcare services to underserved communities. Public health nursing really has a rich history, and the role of public health nursing was shaped by nurses like Lillian Wald in the early 20th century. Wald was known as the first public health nurse, and she literally lived among and cared for poor immigrants in New York City's Lower East Side. And also another nurse that really is an example for us is Nancy Milio, who served an African-American population who she described as poor in money, space, schooling, health, and the chances to do much better. And she served in 1960s Detroit, which at the time, it was a time of great civil unrest in Detroit. And today, in 2017, public health nurses are still caring for similar populations who experience unrest and disparities in their communities. And like Lillian Wald and Nancy Milio, public health nurses are skilled and uniquely positioned in the community to promote equity within those communities. APHN believes that public health nurses are a necessary partner for the future. And in fact, we did a position paper about this in 2016, which you can find on our website. Healthcare is slowly shifting from an individual focus to a community and population focus, and from health care to the promotion of health, and from the reactive to the proactive and the preventive. And public health nurses, as trained professionals with the knowledge of public health, can partner across all areas of the health system, which we're familiar with, but also with a variety of community partners to identify those social determinants of health. And later, after I have let Zenobia speak here for a little bit, I'm going to tell you about some projects that public health nurses are involved with to promote health equity. So Zenobia?
Thank you, Jen. APHN, or the Association for Public Health Nurses, has a commitment to social justice and health equity that's evidenced by the inclusion of health equity pillars in the organization's strategic planning process and the organizational fabric. It's also seen in the ongoing work of the organization's committees and work groups, and as well its establishment of a diversity and social justice committee. The organization has produced and widely disseminated a white paper on the public health nurses' role in promoting health equity, which can be found on our website. This white paper is a call to public health nurses across the globe to renew our commitment to the elimination of health inequities and help build durable public policies that promote and protect health for all and ensure the conditions that support safe and healthy communities. Next slide, please. APHN has also collaborated with the APHN section on its vision regarding health equity. The section also has a strategic vision that's focused on achieving health equity, which includes ensuring that the work receives a special focus in this section through its diversity committee. Next slide, please. The APHN section has a diversity committee that works in conjunction with other disciplines to promote equity in a variety of ways, increasing diversity in the membership, increasing opportunities in practice settings, and increasing the skills of members in addressing inequality and social justice. Next slide. So as we look at health disparities and the disadvantage that it causes in our communities and in our country, we look at the overall annual cost of health inequities, particularly disparities in health, and to the tune of $60 billion a year, it has a disparate effect upon all of us. Racial health disparities are associated with substantial annual economic losses nationally, including an estimated $35 billion in excess healthcare expenditures, $10 billion in illness-related lost productivity, and nearly $200 billion in premature deaths. Coordinated efforts to reduce health disparities could have profound economic value to our society, including reducing days lost from work, reducing excess illnesses and disabilities, and reducing excessive deaths. Next slide, please. So I'd like to utilize this equality versus equity slide to illustrate to us the differences between what we quote as equity versus equality. Equality refers to sameness. It promotes fairness and justice by giving everyone the same thing, but it only works if everyone starts from the same place. And as this example, as you can see, equality only works if everyone is the same height. So the little guy behind the fence, the little guy who's on the right trying to look over the fence, doesn't really have an equal view of what's going on over the fence. When we refer to equity, we refer to fairness. It's about making sure that people get access to the same opportunities. Sometimes our differences or our history can create barriers to our participation, so we must first ensure that equity exists before we can enjoy equality. And this is certainly the aim of public health nursing. Today, we'd like to highlight several programs and initiatives which demonstrate the significant role that public health nurses play in identifying and improving social, economic, and environmental conditions that shape health and promote equity and health behaviors across the United States. APHN recognizes that the experience, knowledge, and skills of public health nurses is a significant factor in the movement to promote health equity and a culture of health. And today we're going to highlight these programs: the Million Hearts Program, a breast cancer management program, the Robert Wood Johnson Foundation Public Health Nurse Leaders Initiative, Nurses on Boards, the Florida Breast Health and Heart Initiative, the EPA Air Quality Flag Program, and the HIV/AIDS Community Outreach Program. Before we begin, though, we'd like to ask you a question, and we'd like for you to respond through the chat function to this poll question. Well, here's a quick poll. It should be on your screen. If APHN could do something to help you to promote health equity in your work, what would it be? Please choose one of the provided answers, and we will share that information with you shortly.
And Zenobia, if people want to choose other, they can write in the chat if they'd like to expound on it.
Thank you, Michelle.
Thank you, Zenobia.
So we're going to give you a few seconds to respond, and hopefully we'll be able to see the poll results fairly quickly. As you can see, the majority of you believe that providing ongoing PHN educational opportunities on health equity advocacy and policy development is something that very much you'd like for APHN to continue, and also supporting providing ongoing examples of diversity and inclusion within our organizational practices, as well as actively promoting diversity in PHN education and PHN workforce. Thank you all very much. If we have some additional comments, we'll share those with you later during our question and answer session. Jen?
Thanks, Zenobia. So this is Jen Cooper again, and I just wanted to talk with you a little bit about a project I've been involved with, and that's the Million Hearts State Learning Collaborative. And I talked earlier about APHN's mission, and I've kind of used that mission here to frame this particular project and how we've been involved. Let me first tell you a little bit about the Million Hearts Initiative. The CDC and CMS jointly launched the Million Hearts Initiative in 2012, and their goal was to prevent 1 million heart attacks and strokes by 2016. So from that initiative, they funded ASTHO, the Association of State and Territorial Health Officials, to launch a state learning collaborative. And to date, there's been 22 states involved in that learning collaborative. Now, CDC and CMS is preparing to launch Million Hearts 2022, and in fact, they're planning to have a greater focus on how they can promote health equity. So stay tuned for more on that. When we have more information, we'll be sharing that. APHN is an affiliate of ASTHO, so when the State Learning Collaborative was launched, we as a national partner, we were one of the 5 national partners within the State Learning Collaborative. And some of our other national partners are listed here, and they include, aside from ASTHO, NACCHO, the National Association of Chronic Disease Directors, and the National Forum on Heart Disease and Stroke Prevention. We are in year 4 of the State Learning Collaborative, which I had said involved 22 states. And what they're doing is creating practice and systems change so that they can improve the identification and management of hypertension. So consistent with our mission at APHN, our role in the Million Hearts State Learning Collaborative is to be the voice for public health nursing in this initiative. So what we're doing is really trying to educate our national partners and people within these teams who maybe aren't familiar with this nursing role all about what we do. We also provide technical assistance to the teams and try to make connections among state teams that have had successful projects, and they kind of help each other along in their work. We've worked to identify nurses on these teams so that we can really show the value of the public health nurses' work within those teams. And APHN helps to shape the role of public health nursing in practice, leadership, and advocacy. So one of the roles of the public health nurse within the Million Hearts Project is to help reduce disparities. And in practice, this means good assessment, finding out what those social determinants of health are that impact people's health related to their cardiovascular health. There's also monitoring and coaching that is done among populations where we know there are disparities. And often the key to eliminating some of these disparities starts with having the right partnerships and the right people and the right teams in place who we know can best reach into the populations that we're working with. And the leadership piece involves developing these partnerships and developing trust and leading practice change and systems change to promote equity among those that we serve. In other words, those at risk for hypertension can be identified and treated. Sometimes maybe that's through a faith community and a faith community nurse. And as I'll describe in the next project, what we want to do is give everyone the opportunity to learn about, for instance, how to prevent breast cancer, how to have access to a mammogram despite their disability, and how they can manage their hypertension. And finally, APHN advocates for the public health nurse role and for health of population so that we can fulfill these roles in practice and leadership. Next slide, please. I also want to tell you about another unique project that APHN has been involved with. We are pleased to partner with the American Association on Health and Disability and the Susan G. Komen National Capital Region chapter to launch breast cancer awareness for women with disabilities. And this innovative community project is an opportunity for women with disabilities in specific wards in the District of Columbia. If you're familiar with the district, that's wards 2, 5, 7, and 8 is where we're working. And also we're working with community mammography facilities who serve these women. Women with disabilities are a medically underserved population, and they're at an increased risk for breast cancer mortality. They're significantly less likely to receive a clinical breast exam and a recommended mammogram screening than women without disabilities. So what that leads to is a later stage diagnosis and decreased chances of survival. These health inequities are often due to physical, environmental, cultural, and attitudinal barriers that women with disabilities encounter when they seek breast health care. This project attempts to decrease these inequities by focusing on the continuum of breast health care services among those women with disabilities. So APHN's specific role in the project is to provide 12 educational workshops on breast health and breast cancer screening within these 4 wards. And speaking of the right partnerships, I'm very pleased to work with Dr. Gloria Jones, a family nurse practitioner and faculty at Howard University, who knows these wards and these neighborhoods and these community centers very well. And she's helping to coordinate and offer these workshops within the DC wards. We're excited to continue our work with the Million Hearts State Learning Collaborative and this DC Breast Cancer Prevention and Awareness Project so we can support public health nurses in their role in eliminating health disparities in their communities within these areas. Zenobia, back to you.
Thanks, Jen. Next slide, please. Another innovative initiative that we'd like to share with you today regarding public health nurses is the Robert Wood Johnson Public Health Nurse Leaders Initiative. The Robert Wood Johnson Foundation has offered community health nurses a 2-year leadership program, which is intended to strengthen the culture of health movement. Those nurses chosen to be Robert Wood Johnson Foundation Public Health Nurse Leaders through training have become senior level advocates able to lead efforts to coordinate individuals, organizations, and communities to build healthier communities. These nurses also work closely with their state nursing action coalitions and they have a relationship that's mutually beneficial in providing a network of important influencers for each to work with on building a culture of health. There are currently 25 nurses from 22 states involved in the Robert Wood Johnson Public Health Nursing Leaders Program. This 2-year leadership development program is designed to strengthen the capacity of senior-level public health nurses. We're very excited to have several APHN members who are a part of this leadership initiative. Another important initiative that we'd like to share with you at our next slide is the Nurses on Board initiative. Through a conglomerated affiliation with the American Nurses Association, the American Academy of Nursing, and the American Nurses Foundation, the Nurses on Boards Coalition exists, which is a group of national organizations working together to increase nurses' presence on corporate and nonprofit health-related boards of directors throughout the United States. Without a nurse trustee, boards lack an authority on the patient experience, the quality and safety that's needed in the largest part of the healthcare workforce. The coalition implements a national strategy to bring nurses valuable perspectives to their governing boards, as well as to state level and national commissions with an interest in health. The goal of this initiative is to put 10,000 nurses on boards by the year 2020. The effort is a direct response to the Institute of Medicine's IOM report known as the Future of Nursing, Leading Change, Advancing Health, which recommended nurses play more pivotal roles on boards and commissions in improving the health of all Americans. This effort is supported by the Robert Wood Johnson Foundation and AARP as part of their collaborative effort to implement the recommendations of the IOM report through the Future of Nursing Campaign for Action. The goal of Nurses on Board is to increase nurse participation on boards. The Texas Healthcare Trustees, in collaboration with Texas, has set a goal to train 400 nurses in governance through the Nurses on Boards workshop. In collaboration with the national chapter of the Nurses on Boards Coalition, they hope to improve the health of communities and the nation through the service of nurses on boards and other bodies. All boards benefit from the unique perspective of nurses to achieve the goals of improved health and efficient and effective healthcare systems at the local, state, and national levels. Since its inception, the trainings have been, over 9 trainings have been held, and over 231 nurses have been trained through the Nurses on Boards workshops. Another initiative we'd like to share with you is the Florida Breast Health and Heart Initiative, known as One Knock at a Time. This initiative is funded by the state of Florida and operates in Miami-Dade and Broward County, Florida. The Women's Breast and Health Initiative is an outreach organization dedicated to educating women about the importance of breast and heart health while providing them with the resources to beat these diseases. It reaches approximately 11,000 households over a 2-month period each year between February and March, and again between September and October, for a total now of almost 100,000 households having been reached since the year 2009. This initiative's core program is targeted neighborhood door-to-door outreach. Trained multilingual volunteers who receive their training from public health nurses provide breast and heart health educational packages and make appointments for breast and heart screenings. Each outreach campaign culminates with a neighborhood screening day. Mobile mammography vans and clinicians provide at-risk women with screens that could easily find early-stage breast cancer and heart disease right in their own neighborhoods. While women wait for screening, they participate in physical activity and nutrition sessions, and upon completion of screenings, women receive a bag of fresh fruit and vegetables along with a healthy eating guide. Referrals for any additional screenings and treatment are provided as needed as well. Qualified women not living in the targeted door-to-door outreach neighborhoods contact the initiative and are provided referrals for screenings performed by collaborating hospitals and medical partners. Each woman screened through this effort is provided an opportunity to receive ongoing preventive breast cancer and heart disease screening. The Robert Wood Johnson Foundation provides funds for a third-party reviewer for this initiative. The cost-benefit analysis demonstrates that it should become a national initiative. We'll have more on that, and we'll provide contact information. Another initiative we'd like to highlight is the Mid-Atlantic Center for Children's Health and Environment at Georgetown University in Washington, D.C. This is home to a unique air quality indicator program, which has been implemented in local schools and other community locations, utilizing the skills of public health nurses and school nurses. Dr. Laura Anderco has spearheaded an alliance between school nurses and universities and other organizations in the Washington, D.C. program to utilize this program known as the Air Quality Flag Program. This program protects the health of those with respiratory illnesses such as asthma, bronchitis, and chronic obstructive pulmonary disease. The program is funded in part by a cooperative agreement from the Agency for Toxic Substances and Disease Registry. Dr. Anderco is a Robert Wood Johnson Executive Nurse Fellow, and she serves as Research Co-Chair for the Alliance of Nurses for a Healthy Environment and Co-Chair of the National Environmental Health Partnership Council. She also serves as Chair for the National Center for Children's Vision and Eye Health Advisory Board through the Maternal and Child Health Bureau, HRSA. The flag program uses brightly colored flags based on the U.S. EPA's Air Quality Index to notify people and their communities about outdoor air quality conditions. Organizations raise a flag each day to reflect their local air quality forecasts and to promote public and community awareness of daily air quality. The EPA Air Quality Program brings public awareness to outdoor air quality conditions on a regular basis. It also promotes creative thinking strategies to keep safe when the air quality is not optimal for children, teens, adults, and the elderly. And it also brings awareness to individuals with reactive airway diseases and allergies to take safe precautions on high sensitivity and high pollutant days. Next slide, please. Another important initiative we'd like to highlight is the HIV/AIDS community outreach that has occurred in Texas. When Dr. Lisa Campbell took the helm of the Victoria County, Texas Public Health Department in 2015, the HIV/AIDS resource program did not have a community outreach program. Dr. Campbell knew a community assessment needed to be conducted, but she had limited resources. She partnered with Dr. Jeff Watson from Texas Tech Health Sciences Center School of Nursing, who conducted a survey of the 5-county HARP service area. Dr. Watson discovered that 2 beliefs about HIV/AIDS would have impact on the success of the community outreach program. One belief, that people need more education to learn how to avoid getting HIV/AIDS, and the other belief that people living with HIV/AIDS do not have a right to confidentiality about their disease. The most striking finding from this survey was the belief that individuals with HIV/AIDS do not have a right to confidentiality about their disease. Although limitations, including the low sample sizes, affected the power of this study to provide evidence for broad application, the findings do highlight the importance of community beliefs when designing and implementing a community outreach program. With implications for testing, treatment, and disclosure, the right to privacy and confidentiality could not be overlooked as a cornerstone of programmatic planning. Together, Dr. Campbell and Dr. Watson reached out to the Health and Human Service Regional Resource Network Program in Region 6 and the Latino Commission on AIDS. The research findings were shared, and as a result, a capacity building workshop was developed entitled Addressing HIV Stigma in Latino Communities. The workshop's day was spent in thought-provoking dialogue, valuing the social norms and core values of the Latino community in South Texas. As a collective, the group developed strategies to target national HIV testing, which was on June 27th, with further work aimed at National HIV Awareness Day on October 25th. The workshop was a collaborative effort conducted by all the partner organizations, and the outcomes ultimately led to the development of the HIV/AIDS outreach program. Leveraging resources is a key strategy to ensure health equity for vulnerable populations. It's a key behavior that is recognized by public health nurses. We have hope for presenting many other promising exemplars of the outstanding work of public health nurses in promoting health equity in our communities when we have opportunity to celebrate the APHN annual conference on April 23rd through 26th, 2017 in San Diego, California at the Bahia Resort Hotel. We will highlight even more examples of the extensive involvement of public health nurses in collaboration and activism in promoting health equity, and we invite you to join us at the conference. As we talk about health equity, and we move to our next slide, many mentions about the culture of health and public health nurses' involvement bring to mind some of the behaviors and some of the work that needs to occur among public health nurses in terms of incorporating behaviors into our practices. We need to continue to enhance our skills in improving population health, addressing social determinants of health, anticipating and responding to changing trends in health and healthcare, and influencing policy decisions and creating collaboration efforts across sectors in our communities in order to promote this culture of health. Another important PHN practice model of the future that is going to be extremely important to the ongoing work of public health nurses in promoting health equity is the extraprofessional collaboration practice. An essential model of practice which includes putting patients first, demonstrating leadership commitment to interprofessional collaboration as an organizational priority, enabling team members to work at the top of their license, know their roles, and understand their value, cultivate effective team communication, and explore the use of organizational structures to hardwire interprofessional teamwork and team-based care practices into our work. According to the American Association of Colleges of Nursing, the American Association of Colleges of Osteopathic Medicine, the American Association of Colleges of Pharmacy, the American Dental Association, the Association of American Medical Colleges, and the Association of Schools of Public Health, this practice model requires the continuous development of interprofessional competencies by health professional students as part of the learning process so that they will enter the workforce ready to practice effective teamwork and team-based care. The development of interprofessional collaborative competencies requires moving beyond profession-specific educational efforts to engage students of different professions in interactive learning with each other. Being able to work effectively as members of clinical teams while students is a fundamental part of the learning, which is then made manifest as health professional students enter into the practice world to work on collaborative teams. This is true for public health nursing practice most acutely. The need to address complex health promotion and illness problems, such as health inequities, in the context of complex care delivery systems and community factors, calls for recognizing the limits of professional expertise and the need for cooperation, coordination, and collaboration across the professions. However, effective coordination and collaboration can occur only when each profession knows and uses the other's expertise and capabilities in a patient-centered way. And public health nurses have we've done a lot of work in this area and will continue to be leaders in this area in leading these interprofessional teams. So as we look at the value of health equity and what it brings to our communities, we know that public health nurses work very hard to improve community health and access to care. We know that we work well with collaborative groups and we listen attentively and are sensitive to cultural differences. We have to manage scarce resources creatively and focus our efforts when we have to do the most good wherever we are. It's in the professional DNA of public health nurses to advocate for and tend to the needs of at-risk and hard-to-reach populations. Nurses continue to outrank other professions in the Gallup Poll's annual Honesty and Ethics Survey. Over 81% of Americans say that nurses have very high or high honesty and ethical standards. Public health nurses recognize the moral imperative for promoting and seeking health equity. Health equity means social justice with respect to health. It is a reflection of ethical and human rights concerns such as non-discrimination and equality. For the public health nurse, health equity means equalizing opportunities in order for all communities to be active and healthy. Achieving health equity requires untiring efforts to seek and make improvements among those who are at the bottom of our social strata and our health ratings. We have another poll question we'd like to get your response on. What are some of the successes you have experienced in your work to promote health equity? If you will go down to the chat function and share your responses, we'd be happy to share some of your answers and also to entertain any questions that you might have at this time. Thank you very much.
If your chat box is not empty or is not open, you can go to the bottom of your screen and click on chat and it will open the box for you.
We'll give you a few more seconds to respond.
I see one response which says open access scheduling. I see another one from Nancy saying using a strengths-based approach to clients and community. I see another response that says incorporating the requirement to adopt health inequities in local public health contracts. Centering pregnancy groups, another good example, helping students to see health inequity. Very important. Focus on health literacy. We have promoted a program in public housing, working with our local FQHC to support good access to primary care, hiring practices. All great examples. Providing breast screening and mammograms to uninsured women, implementing free Zumba classes to underserved community, providing educational sessions in languages understood by the audience, in-house PEP. We thank you for sharing your examples. Here's some more: maternal child outreach, free adolescent clinics. Zenobia, I'd say those were some very good examples.
Absolutely.
And we're happy to hear of your success, by the way.
We'd like to highlight many of these examples that you're offering, particularly during conference. We'd like to have an opportunity to perhaps share some of the work you're doing if you all are interested. We'd love for you to bring some of those exemplars with you to conference, and we'll set up an area to post them, perhaps to share with others. If you have materials that we could distribute, we'd love for you to bring them and share. I think that's going to be an important part of what we do, sharing the work that we're doing, so that we continue to further information about, or the awareness about, the work that public health nurses are engaged in promoting health equity. Some additional information coming in.
I saw one more added: expanding access to care for HIV positive individuals. Oh, students using public health practicum sites to engage in what they've learned.
We see the free adolescent clinics.
Yes, great idea. I know some of our public health nurses are also involved with school-based health center. Oh, Martha writes sliding fee scales. That's an important one.
Absolutely.
So now we're available for questions and comments. Zenobia and Jen are here to take your comments.
We'd love to hear from you.
So the same thing may be said for your Q&A. If you aren't viewing your Q&A on your screen, you can open it by going to the little icon at the bottom of your screen. Any questions for our speakers today?
Michelle, I see there's a question about the CNE for today. Can everyone see that response?
I'm not sure if they can. Our Association of Public Health Nursing members are eligible for the one contact hour, as are the North Carolina Public Health Nurses, as a result of our partnership with North Carolina. However, if you need a certificate of completion to provide to your employer, you may email Kate Burnett at, and my screen is not showing the whole thing. Hold on a second. At capital K, Catherine, dash, check at uiowa.edu. And Kate has just put her email address up in the chat box.
Michelle, do you see the question there from Tracy? That
No.
the Florida
not.
Breast Health and Heart Initiative, is it only being implemented in Florida? Zenobia?
That particular initiative, the way that it was mentioned in this workshop today, is only being implemented in Florida. But as Jen mentioned, there are many other similar type of initiatives being implemented in other locations, about 22 other locations around the country. Jen, are you still online?
Yes, and the DC Breast Cancer Awareness Program that I was speaking of is specific to the District of Columbia, funded by the Susan G. Komen Foundation in the Capital Region.
Other type of initiatives like that that are similar, that have that reach wide audiences. If anyone is familiar with or aware of other similar initiatives, we'd love to hear about them.
Mm-hmm.
I'd like to have a compendium of these types of initiatives to be able to share with other public health nurses.
There might also be additional information on the HRSA website.
Christina asks, how can I get a link to the Toronto model of intraprofessional service mentioned under subject ECP, Extraprofessional Collaborative Practice?
We can, I'll try to post that link on the chat function.
Okay.
Great questions. Any more questions?
Tracy's asking, there's commenting, thank you. Did you say HRSA website?
Yes, only it's hrsa.gov.
We have just a few more minutes if there are any other questions.
I see a question. Will PowerPoint be available?
And I can answer that question. The PowerPoint will be available on the APHN website for APHN members.
I also see another question. How can I get more information about the Robert Wood Johnson Public Health Nursing Leadership Initiative?
If you will, you can You can receive more information on the Rebel with Johnson website, www.rwj.org,
I think it's RWJF.
rwjf.org.
Right. How will revisions of the Affordable Care Act affect public health?
Great question.
Great question.
Great
Well,
question.
if you all have time for another hour, we can sit here and discuss that. That is really yet to be seen. And this is Jen Cooper. I think we, part of what APHN's work is doing is to try to protect and advocate for the protection of the some of the things that the Affordable Care Act has put in place that have given people better access, and also to advocate for the protection of programs funded by the Prevention and Public Health Fund. And we do that by really trying to stay connected with our partners through ASTHO and NACHO, and through the nursing community, where I'm a liaison and work closely with the nursing community, who's writing letters and always speaking with the new administration about where we're going to go from here. So I think that's a great question, and
Jen,
we have kind of, yes.
will you explain what the nursing community is?
Oh, sure. The nursing community is part of the association, the American Association of Colleges of Nursing, and it's a collaborative of 63 nursing organizations. APHN is one of those organizations. So we're constantly signing on and planning briefings and talking with administration through the nursing community and the leaders there to try to, advocate for, for how the Affordable Care Act, or whether it's repealed or replaced or whatever happens, how we can protect some of the things that are in place, including, public health in that role. But again, we have a new HHS secretary. There's a lot of new people. So it's just educating them and making sure they're hearing our nursing voice.
If people need a reference for how to follow some of these issues, the Kaiser Family Foundation website is a really good source of information, I think, of very up-to-the-minute information.
Mm-hmm. That's true.
There is one more question that has come in. Was there a website associated with the Air Quality Flag Program?
Is that AHNE's website?
Yes. We can answer that by text.
Okay. Are there any more questions, Jamie, that you see?
I do not see any more.
Okay. So if there are no more questions or comments, we will conclude today's website, or today's webinar. Jamie, can you show the last slide, please?
Yes.
We are celebrating our 80th year for public health nursing, so thank you. But for further information on this webinar and other programs offered by the Association of Public Health Nurses, please go to www.phnurse.org, or you can call the number that you see on your screen, 614-846-1777, or reach us directly, exec director at phnurse.org, or admin assist at phnurse.org. Thank you again for attending today's webinar, and thank you very much to our two speakers, Dr. Cooper and Dr. Harris, for a great webinar today. Thank you so much. And we look forward to tuning in next month. Thank you.
Thank you.